I'd love to introduce our next speaker, who is Dr. Helen Bevan OBE. She's the Chief Transformation Officer for NHS Horizons, and she'll be discussing leading change in health and care. Dr. Bevan, are you there with us?
Yeah, I'm here. Hi. It's fantastic to be with you this morning, and yeah, really happy to share some of my experiences and ideas.
Fantastic. Can't wait. Right. Well, Sandy and I will head off, and the floor is yours.
Thanks so much. And yeah, so my topic is about leading change in health and care, and I'm a full-time leader of change in the health and care system. But what I want to get across now is that everybody that works in health and care is a leader of change. And what I'd say, whatever job we do, that in a sense we have two jobs. We have the role that we do every day. So whether we're a doctor, a nurse, an allied health professional, a manager, and then we have another job. And the other job is about improving the health and care system, and I think it's a responsibility for all of us. And so what I want to talk about now is when we think about the health and care system. So whatever country we're in, okay, whatever we're doing, whether we're whether we're a student, whether we're in training, whether we're somebody who is is doing a clinical job every day, how do we build the confidence, the courage and the power to challenge the way things are and get things changed? Because whatever role we'll do every day, we'll see opportunities to do things better. We'll see opportunities to improve the experiences of our patients, to make things safer, and to improve things for our colleagues. And when we think about that, I think we need to think about it in two different ways. There are tactics that start with me on the inside. And if I'm going to be leading change and making a difference, then I have to build what's called my own self-efficacy. And I want to come on a bit more and talk about that. But self-efficacy is about the confidence and beliefs that I can change things and I can make things happen. And then the other tactics are, if you like, the tactics that are on the outside with other people about how I collaborate, to make things happen. And the key thing that we need to think about is power. The power to make a difference. And I love this quote by Alice Walker. She says, the most common way people give up their power is by thinking they don't have any. So how do we build our own confidence, our courage to stand up and say things aren't right and I need to do things differently? And how do I build the courage? And how do I build power? So I'm going to start off by talking about me. And here I am on the left-hand side, and I'm 19 years old, and I'm a student of social science at Manchester University. And it's a long time ago, as you can see. And when I think about me as a 19-year-old, I was a student of social science. I was fascinated by people and society and what made things tick. And I was adamant that everybody had a right to health and healthcare. Everybody had a right to education. And I saw so many things in the world that weren't right. And I was very active, in my local community, and I could really see the difference between people that had privilege and people that didn't. And I was prepared to link up with others and collaborate and march and take action for change. Okay, that was me as a 19-year-old. I want to show you another photo of me, which is 3 years later. And my question is, what happened? I'll tell you what happened. I got my dream job. My dream job after graduating was to be a trainee in local government, because I wanted, I was a social scientist. I wanted to be a public servant. That's all I ever wanted to do, was to make a difference. To be part of the system, to tackle differences in power and privilege, to make a difference in the world. So I got my dream job in local government. But what happens when you go to work in organizations is like these tentacles of, like, I'd almost call it like normalization, how you're meant to behave, what you're meant to do to get on. So even though I wanted to change the world, You know, I wanted to be respected, I wanted to be valued, and I learned that I had to conform. And, you know, when I look at me now, who is probably in the last stages of my career, I connect so much more with that person who was 19 and how she was in the world. Because, you know, this person, you know, this version of myself, what I thought was, you know, I don't need to stand on street corners. I don't need to collaborate with communities because I'm in the system and I can change it from the inside. But, you know, the reality was that actually what I became was, you know, almost part of the status quo. I actually became part of the problem that that stopped change happening. So, you know, which one are you most like, and how do you want to change the world? And, you know, if we look at where we are now, you know, in terms of our world and what's happened as a result of the pandemic, you know, I think what we've all seen, those of us that work in the health and care system during the pandemic, is that we've had to change things really quickly, and so many things that we thought we couldn't change have happened so quickly. I mean, just an example might be something like, you know, digital consultation. We thought it would take 10 or 15 years to move to a situation where digital consultation in health and care became the norm, and we've managed to do it, you know, in a few weeks and a few months, and so many things are becoming disruptive. But, you know, what we have to ask is now, hopefully, that you know, that things are a little bit less urgent and we're looking forward to the system. How can we keep the innovations and the changes? You know, how do we keep this disruption to our system in a really good way that enables change to happen? And this is from my system, the National Health Service in England. But my team, we did a survey a little while ago with lots of our colleagues at the front line of care, doctors, nurses, allied health professionals, support workers. And the one piece of feedback we got was, yes, I can see so many ways that we can change things, you know, in terms of our system, but we haven't got permission. You know, I'm only a student, I'm only a trainee. I can't make change happen. I haven't got the power to make change happen. And the reality is, all of us have got the power. We just need to take it. And this comes from Bertrand Russell. He's the father of modern logic, and he says power is the ability to produce intended effects. And, you know, all of us, when we look at our systems and we want to make things better for our patients, you know, we want to make things better for our colleagues. How do we, you know, take the power to do that? And, you know, looking into this future, looking into the you know, the terrible things, the tragedy that happened as a result of the pandemic, and how we want things to be different in the future. Okay. We need to be the change agents who will illuminate the way forward. You know, we need more people willing to step outside of expectations, because our world is changing exponentially. And if all we do is to meet expectations and follow the status quo and do the things that we've done, you know, we will fall behind as organizations, as teams, as health and care systems, and as societies. So it's about our job to make a difference. This comes from a guy called David White, and he is an organizational poet. And this is something he wrote, you know, I do not think you can really deal with change without a person asking real questions about who they are and how they belong in the world. And again, whether you're somebody who is thinking about a career in health and care, you're a student, you're a trainee, you're a clinical professional, we all need to be asking this question, you know, who am I and how do I belong in the world and how do I make a difference? So this comes back to this point about self-efficacy. And the people that I see able to make the greatest change in our system are people who have got a strong sense of self-efficacy. Okay, and the person who's like the father of thinking about self-efficacy is a psychologist from the USA called Albert Bandura, and he says what self-efficacy means. It's about our belief whether we think that we can do things or not. So our ability to take action, to make a difference in the world, is tied to a belief that it's possible to do so. And so in a sense, what self-efficacy is our sense of conviction that we can successfully execute a task to produce the results we want to see. Okay, if I was going to put that in a way that's probably simpler, I would take this quote from Henry Ford, you know, the motor guy. And he said, if you think you can or think you can't, you're right. So our sense that our ability or our confidence that we think we can do things actually makes a difference whether we can or not. And if we actually look at all the data, what it shows is that there is a positive, significant relationships between the self-efficacy beliefs of a change agent or somebody that's trying to make change happen and their ability to facilitate change and get good outcomes. So when we think about leading change, okay, it isn't just about, oh, let's look out into the world and see the things that we can change and use improvement methods. Actually, the most fundamental thing is about me and my beliefs. And do I think I can do this or not? And again, here's Otter Sharma, you know, leading from the emerging future. Let's think about the emerging future that we want to create post-COVID, you know. Our success, the success of our actions as change makers, people leading change, okay, do not depend on what we do or even the methods of how we do it, but the inner place from which we operate. And this is Deborah Rowland. Like me, she's a social scientist, and she said, you know, if we're people that are leading change, okay, if we're trying to make change happen in large complex systems like health and cares, okay, the extent to which we can focus on our inner skills for change, so the extent to which we can build our own self-efficacy and the things that we're thinking inside our heads, rather than just being the kind of change leader that is like trying to use change methods to make change happen, by focusing on both ourselves inside and things that we do outside, we increase our chance of success by 52%. So, you know, what do we need to do and how do we need to do it? I'd say the key thing here is about being boat rockers. And what do we know about boat rockers? Okay, these are the people that can rock the boat in a health and care system, can challenge the status quo, but manage to stay in it. And, you know, being a boat rocker is walking this very fine line between being different and standing out and challenging and fitting in. In a sense, we as change leaders, we need to be people that both are part of the inside and the outside of the system. You know, one thing I've learned as somebody who's led so much change in the NHS in England over the years is at the heart of this is about our ability to both conform and rebel. So I work in a little team of change leaders called inside the NHS called the Horizons team. And we know that in order to do the stuff that the you know, more rebellious things, the more challenging things that we want to do, we've got to be the best corporate citizens in our organisation. So we always get our business plans in on time. We always turn up on time for meetings. We never ever speak badly of other people in our organisation, because we know that we've got to conform, we've got to be the best possible corporate citizens around all that sort of stuff, because that gives us the space and the trusting relationships that we can do more rebellious things. And you know, we talked about this is the age of disruption, but you know, who are the people that are the best disruptors? Okay, the people that are the most successful disruptors in our organizations aren't people that charge around creating havoc like unguided Exocet missiles. You know, oh, you've got to change this, you've got to change that. This is wrong, this is wrong. Actually, the people that are the most successful disruptors are the people that do that with and through other people. They're the people that are building the best relationships. They're the people that are capable of working with other people to create success, not the people that are perceived by other people as destructive troublemakers. So, you know, I know that many of you here are at the early stages of your career. So what I want to say to you in terms of thinking about leading change, okay, how can you be a boat rocker rather than the people that fall out of the boat? What do we know about successful boat rockers? Well, they're people that are passionate about the person-centered or the patient-centered mission of our health and care organizations. They're people that can keep perspective, you know, they're optimistic, Okay, they have high degrees of self-efficacy, and they generate energy. They attract other people towards them and their change ideas. Okay, it's all about relationships and connections. They see potential and possibility, and they're able to work effectively together with other people. What do we know about the people that fall out of the boat? Well, they're complaining, okay? And there's nothing wrong with complaining or being angry, but what you often see with the people that have fallen out of the boat, the focus of their anger is me, okay? The injustice of my situation, how badly I'm being treated. And very often people that have fallen out of the boat actually used to be the boat rockers. Okay, but they find themselves in situations where they don't get listened to, where their ideas get dismissed, and it's happened so many times. They lose hope. Okay, so they're pessimistic. They will sap the energy of people around them and alienate others. They'll see problems, and they won't. Whereas the boat rocker is seeing opportunities and possibilities and is suggesting things, okay? The people that have fallen out of the boat will see problems in everything. And as a result, they're often alone, okay? Here's a quote from Benjamin Zander, who used to be the conductor of the Boston Philharmonic Orchestra. And he says, "A cynic, after all, is a passionate person who doesn't want to be disappointed again." And I see so many people, okay, brilliant clinicians who started their careers, as boat rockers, full of hope and possibility, and they find themselves in environments where, that are dysfunctional or toxic or not well led, and they fall out of the boat. And it's such a sad thing. And if you looked at all these characteristics here about what makes an effective boat rocker, okay, what I'd there's 8 things there. Which of those do you think is the most important for rocking the boat and staying in it? Of those 8 points, or those 8 characteristics of a boat rocker, okay, which do you think is the most important to be a successful boat rocker who either doesn't fall out of the boat, or when they do, they get back in quickly? I'll show you. It's together. The number one thing we'd say about leading change in health and care, or being an effective change agent, it is about the ability to work effectively with other people. And I learned this a very long time ago. However creative we are, or however passionate, or however much we believe in the things that we believe in, okay, our organizations, okay, they have these tentacles that I talked about before, that kind of push you to conform or do things the way that they're done now. And unless we connect up with other people, things are never going to change. I think what I'll do is I'll stop there, because I want to have a few minutes for Q&A. So what does this make you think about in terms of leading change in health and care? Okay, how does this make you think in terms of as you move forward in your health and care career, how you can be a boat rocker, how you can as well as your clinical role, work every day to improve things, to make care safer for patients, to improve the experience of patients, to make things better for our colleagues. So back to Q&A.
Perfect. Well, thank you so much for being with us this morning. Now, we've got 2 minutes left, but we do have one. Oops. Hello. Yeah, you can all see me.
Hi.
Perfect. So yeah, we do have, no, you're absolutely right. The importance of working with others to kind of create success is a fundamental kind of aspect of leadership that I hope everyone here can take from it. Quick question. So here at the Health Careers Live program, we're trying to do our best to bring together professionals from all sorts of communities and showcase them to aspiring and current healthcare students and professionals. Why do you think this kind of work is so important?
In terms of that, do you mean why do I think healthcare work is so important, or this work of bringing people together?
Bringing together.
Yeah, that's such a great question. Bringing people together is so important, because you know, and from my point of view, in terms of the kind of work I do around leading change, because if you've got like a group of doctors and you're trying to make change happen, the way that often a group of doctors will see the world is in a doctor way. And it's only when we bring other healthcare professionals together. So we have nurses, we have allied health professionals, and absolutely critical patients themselves. Okay, you know, the more we're bringing a diverse group of voices together, the better outcomes we will get. And you know, as we look forward, you know, in our health and care systems, and we think, you know, the generation of people that are taking part in this event today are the people who actually will be leading health and care in 20 or 30 years' time. And we know, you know, that we can't carry on just as we are. Okay, things have got to be radically different. You know, our populations are changing and their needs are changing. Technology is developing at such a fast pace. Populations are getting older, and so we need a huge amount of innovation and different thinking in our system. And it's only when we bring all those diverse voices together and, you know, getting people collaborating that we will get the kind of breakthrough thinking and innovation that comes from diversity. So you know, I'd say collaboration, particularly in the context of change, isn't just a nice to do. It's absolutely critical if we're going to have the kinds of health and care systems moving forward that are going to meet the needs of our populations.
Collaboration is key. Thank you very much, Dr. Bevan, for joining us this morning. Really appreciate you taking the time and hope you have a lovely day.
Yeah. Great. Enjoy the rest of the event.
Thank you.